Speaking on behalf of the Minister for Health, the Director of the Ministry, Dr. Hafiz Adam, at a conference on project closeout, dissemination and launch of new projects, and closing a workshop on supporting of evidence-informed priority setting in Ghana's health sector when it comes to non-communicable diseases. He further said as part of this year's new project with sponsorship from Norwegian companies and partners, people would be trained from the lower level to a higher level to enhance the capacity of the health ministry. A scholarship for 2 PhD studies for staff from the Ministry of Health as well as 4 candidates for master's program.
To close a workshop that we've been doing on priority setting in the healthcare sector, particularly when it comes to NCDs, that's the non-communicable diseases. We have a project which has been renewed, and that will be the new project will be starting from 2026 to 2030. That is being sponsored by Norwegian, companies and partners. So in effect, there's a capacity building where people will be trained from lower level to the higher level. And I'm happy to report that we are receiving a scholarship for 2 PhD, studies for staff from the Ministry of Health, as well as 4 other candidates for masters to go and do their further studies in this area to come and augment the capacity of the workforce of the ministry. So indeed, we have just concluded with the first one, and this is the second stage where it's been renewed and it's going to be sponsored, as I said, by BSEP. We are partnering with BSEP. And so this presentation to highlight the areas that we have made progress, and then looking forward to working with the new project where we have understood it and noted the gaps, and that is exactly what we have just concluded. So the data of the Mama case, that's the Ghana Medical Trust Fund president, because of the importance of their involvement. You are aware that we are looking at chronic diseases, and we are also looking at a situation where any Ghanaian who is suffering from any of these conditions should not be barred from services because of financial barriers. And that's why she was explaining what the Mama case seeks to address beyond what the National Health Insurance covers. And so these are the other areas that we talked about. No, that's a lie.
Associate Professor at the University of Bergun, Lumbar Chorla, commented on the effective budgeting for the health sector by the government.
Mainly looking at strengthening the systems for priority setting in Ghana. And by that, what we mean is strengthening how we look at how to provide healthcare in the country. So in any given country, you have a limited budget for healthcare services, and you have to make very tough decisions about what you produce in terms of healthcare, how you fund it, the resources that you spend. There are so many things that are placing demands on our healthcare budget, and we have to make those very tough decisions. Should we invest in maternal health? Should we invest in elderly care? Should we invest in non-communicable diseases? So these are the things that we have done over the last 2 years, working with the Ministry of Health to set up a system that will help our government to do this. So a few key highlights, I think, are that we've focused firstly on non-communicable diseases, and we've tried to use the methods for priority setting in healthcare to develop a package for non-communicable diseases. And by that, I mean we've used some system of deciding what goes in and out, or what we should include or exclude from our benefit package for healthcare in Ghana.